Okay, good afternoon, everyone. My name's Nina Shah. I'm Comms and Engagement Manager for Healthy London Partnership. I'd like to welcome you to today's webinar for Enhanced Health in Care Homes, Winter Readiness, and today's webinar is aimed towards commissioners. We will be holding another webinar next Wednesday, which is for providers. So if there is anybody in this call who would like to attend that one as well, please do register for that, and that will be taking place next Wednesday. Just to let you know, today's session is being recorded, and the recording and slides will be sent out to everybody tomorrow. And can I please also ask that while you are on this session, if you could please make sure that you're on mute. Finally, the last 15 minutes of the session will be for questions, so please do put your questions into the chat box throughout the session and we will aim to answer as many of those as we can towards the end. I will now hand over to Ezra Kanimo, who is the Enhanced Health for Care Homes Lead for London. Thanks, Ezra.
Thank you, Nina. Can we get some slides up, please? Thank you. Welcome, everybody. And as Nina has already said, this is the Winter Readiness webinar for commissioners, and this is the second one that we're having today. And as Nina said, my name is Ezra Kanyimo, and I'm the Enhanced Health in Care Homes Lead for London. So the purpose of today, next slide, please, is to talk more about how we can get you guys ready. I'm sure most of you have already started to get ready and are already underway in your plans for winter. And this webinar will talk about the collective approach we've taken. And I included ADAS, Public Health England, STP team, CCGs, local authorities, and this was all to try and help raise awareness of what we can all do to prepare care homes for the winter. And some of the key actions we want you to bear in mind as we go on today is to review the flu SOP, standard operating procedure, when it comes out, which will support in the management of outbreaks. We would love for you to disseminate the flu vaccine campaign toolkit that we've developed for you guys, and also the workforce risk assessment webinar, which will help with risk assessments and support for some of the colleagues, especially the BAME colleagues. Also, we would like you to disseminate the resource pack, which will help you with some of the needs that care homes have, and also to ensure that people understand the use and responsibility of capacity tracker, as well as ensuring that the data security is being done, because that will help you with your emails and also the compliance of the regulations. Thank you. Next slide, please. So briefly, we'll talk about the EHCH framework and also the governance around what we're doing. Next part, we'll be talking about the flu and also about the standard operating procedure. And as you can see, the other areas will involve the resources, and we'll end by trying to share good practice and questions. So one of the things we will do is I will have quite a few going to help to share the webinar and speak to the slides today, and they will be introducing themselves when we come to those sections. Next section, please. So I will start and just tell you a little bit about EHCH framework and the London governance. Next slide. So if you don't already know, the EHCH framework is not new. It's been around since around 2016, 2017, and it got refreshed this year. And we wanted to highlight that there are areas which are highlighted in red, which includes the oral care, the continence, promotion, and management, the flu that we're talking about today is part of the winter preparedness, and the other areas which are highlighted. So all of these are there to try and support you guys to know what elements we should be considering, and also these will hopefully enable care homes to not have unwarranted variation. Next slide, please. So, as you know, COVID changed a lot of plans this year. And one of the things that changed in terms of the EHCH framework is we suddenly had a rapid rollout of NHS Mail, which is currently over 75%, and also capacity tracker around 98. I'm sure it's much higher now, coverage. And we also ended up having to learn more about hypoxia in elderly and how that could be detected. Oh, I can't pronounce that word. How we could find out early for those that were struggling with hypoxia, and deployment of pulse oximeters. And as you know, there's a lot of digital agenda we've been talking and addressing during COVID. And going forward, some of the national priorities will change for the enhanced health support in care homes. And this includes the weekly care home rounds, which are coming by through the DES, for those that are aware of what DES, which is where the primary care network is supporting the enhanced health for care homes. We'll also be looking at the dentistry, which will work alongside with the oral health care. And also there'll be the wider rollout and training to support care homes on recognizing deteriorating person.
Can I please go on mute, please?
Some work around quality improvements, focusing on aging well and patient safety collaborative. Next slide, please. Sorry, bear with us. Sometimes there's a bit of a lag with slides moving forward. So while we're waiting for the next slide, I think the next slide would be talking about the governance, as in how the space of enhanced health in care homes is being governed. And I think one of the things to highlight was early on when the COVID started. Can we go to the next?
So can I just check, should you be on the EHCH framework and flu prevention and management slide?
Can we go to the next one? That's okay.
London Regional Care?
Yeah, thank you.
Good stuff.
So the Regional Oversight Group, which is co-chaired by the senior social care and NHS leaders, has been kind of holding the overall sight of the care homes work. And sitting underneath it is the enhanced health in care homes and a series of subgroups which work on the and also working on the resource pack. I'm sure some of you have received a resource pack, which is like our one document to enable care homes to navigate the guidance, lots of guidance that have been coming out. We also have a discharge working group, which has been working on best ways, top tips and tools to enable discharge to work very well. We also been talking about the relative and the resident's voice, and as you already mentioned, the digital working group. If we go to the next slide, please. So, looks like I'm doing lots of talking today. So this section is about the SOP, which is the Flu Standard Operating Procedure. Next slide. And this is just to remind you guys about what support is available to enable you to manage any outbreaks. And the SOP is not new. And I think following several outbreaks in 2017, 2018, it was felt that it was important to have a standard operating procedure to support homes with responding to an outbreak. And it pretty much contains lots of outline of the roles and responsibilities for care homes managers, residents registered GPs, local health protection teams, CCGs, and community providers. And if you go to the next slide, please. In the SOP, you'll find that the latest update of the SOP is how COVID and influenza can happen at the same time. And we just wanted to highlight to you guys that care homes are vulnerable and will be vulnerable to both viruses. And it's important that in the amazing work that you're doing, you be able to make sure we've got a plan to be managing both, and the SOP will support you with that. Next slide, please. And testing and retesting will be very important this winter, because they will enable people to identify whether it's going to be COVID or whether it's going to be influenza, because as we know, the two can present in a similar way. So testing will help, especially where we determine that if outbreak is due to COVID, then your local health protection teams will then provide guidance on the use of Tamiflu and how that can be used in treatment or prophylaxis. As we know, currently there's no evidence that Tamiflu is of use in the treatment or prophylaxis of COVID-19. And of course, the resource pack, which we mentioned earlier, would help in terms of how to access testing and also how to support care homes with any other winter things that need to be in place. Next slide, please. This just tells you more about the process or the protocol of how you would identify between the COVID and the influenza. If you go to the next slide, please. Of course, if any outbreaks happens, it's important to be ready. So one of the top tips is around making sure you have a list of the residents, and so that if you then have an outbreak, then it's easier to communicate, and then the response can be quick in terms of if prescriptions needed to happen in terms of, say, Tamiflu, for example, then people will be able to manage it a lot quicker. And I'm sure most care homes will be aware of this because we've been talking about these messages every year. Next slide. And we also know that during this period, visiting has been quite a challenging thing for care providers. And in our resource pack, you find this slide, which will just enable care providers to know how they can navigate the challenges around visiting. For example, the importance of local risk assessments, the importance of balancing the benefits of residents against the risk of visitors, and things like enabling families to see their loved ones. So if you get time, please look at this because it will support how you can manage visits. Next slide. It's also important in terms of record keeping, because in everything we do, it's important to make sure we're keeping track of what we're doing. And for our staff, nurses in particular, and other health professionals, part of their code of conduct is to ensure that they are keeping good records. And that will make sure everyone is kept looked after well. And it also helps that everything that's being done is contemporaneous. And also, if you wanted to go back to find out how well we've worked, we'll be able to track that. And also CQC expects good record keeping. So this is good practice, which will support care homes. Next slide, please. For this part, I've got a colleague, Catherine Heffernan. don't know whether she's joined us as yet to speak to this particular slide. Catherine, are you there? Catherine Affaden?
Yeah, it doesn't look like she's joined, unfortunately, Ezra.
Okay. Sorry, you're going to be listening to more of me now. I'll go through the slides and hopefully if Catherine joined us, then I will pass on to her. So if you go to the next slide, please. So we know that flu affects 5 to 15% of the worldwide population every year, and we know it kills about 11,000 people, and care homes tend to be affected the most. And we know that anyone can contract influenza, and being healthy doesn't protect against infection. And for those who are higher risk, it can result in deterioration of the chronic conditions, hospitalization, and even death. And unfortunately, the risk groups tend to be our residents who are in care homes. And flu can make chronic conditions like diabetes worse. And we know that people with diabetes are 3 times more likely to be hospitalized. So the best protection is flu vaccine. And we know that it's easily administered and it will take a couple of weeks to provide protection. And we know that influenza virus has a great capacity to mutate. So that's why every year we always talk about new vaccine, which we need to have. Next slide, please. So in terms of how the influenza works, we know that the vaccines against seasonal influenza take advantage of the adaptive immune system by exposing the body before the seasonal influenza epidemic starts. So in other words, you're getting a way to protect you before the influenza does come round, and it can help to reduce the chances of getting flu by 70 to 90%, which is really a good percentage. So we would really encourage you guys to get a vaccine, or encourage the care homes you're looking after to get a vaccine, because it will protect not only themselves, but those they're looking after. Next slide. This slide is just to try and promote the messages of why staff need to be vaccinated. We know that they had just under 3,000 outbreaks in care homes in 2019 to 2020, and a massive 70% of all those outbreaks were around a third of those were care homes. And it's important that staff need to be vaccinated, because we know that once these outbreaks start, happening in care homes, it can impact a lot of our residents and our staff. We also have a short film, which is brilliant film that will help in terms of care homes. When you have staff who might think, well, how does getting a flu vaccine help to manage outbreaks? But we know that in Sutton, one of our care homes had a massive outbreak, but through managing and getting the flu vaccines enabled them to manage the outbreaks a lot better. So I think the messages we're trying to give you today is it is important to get vaccinated, because when you do that, it reduces outbreaks in care homes. It helps your co-workers by not being off sick, which can also increase their workload, and it will protect your family, and also possibility of infecting those that we're looking after. And we also know that if you've got flu and then you catch COVID, that can be a double whammy, which doesn't help your health. Next slide, please. While we get into the next slide, it's important to also highlight that by getting a flu jab, it's an extension of your PPE like you were doing with COVID. So it will be great if you can be sharing some of these messages. So this slide and the next are just frequently asked questions, which can help you to support the messages of getting a flu jab in terms of, is the flu vaccine safe? When can you get a vaccination? How do I know if you have the flu or COVID? If you go to the next slide. So we just provided you these slides to enable you to share the messages. Next one, please. So in terms of the London targets, we're expecting at least 75% of the care home residents to have the jabs. It will be great if we can get to 100%. And we're also expecting to have 100% offer of all care home staff. And this is to increase uptake of influenza across care home and residents and to achieve the national ambitions. Next slide. Another thing to bear in mind with care home residents is ensuring that they're also getting the other vaccines on top of the flu, which include the pneumococcal vaccine, which will protect against invasive pneumococcal disease. Also the shingle vaccine, which is very, very important. So it's just ensuring that as care homes, as we're preparing for the winter, we're also considering these vaccines for residents. In terms of who will provide the vaccination for residents, it will be the named GP who arrange the vaccination for your residents. And when you contact your named GP, the flu, they can then help you to make those arrangements. And the flu vaccinations can also be administered by the community pharmacy. Next slide. And like I said earlier on when we started, we do have a flu vaccine campaign toolkit, and this is a toolkit that we put together to just help you to navigate the lots of resources which are out there, and it will just enable you to think about what core messages you might want to be giving to your staff, that care homes might want to be giving to their staff. It will also include the kind of printed resources they may use, or the digital and social media resources. And also we have example of tweets and messages that people can share. And also it will enable you to know about what the star lines that this care homes will need to talk about. And also the last thing on this list is about the FAQ, which we talked about early on. Next slide, please. So we know that the EHCH framework, one of the best practices is to ensure that every care home has an identified member of staff with the responsibility of running the flu immunization campaign. And the campaign should not focus on just staff and residents, but also family members. As we said, anyone can get flu and anyone can help spread that flu if they don't have the jab. So it's important that people who are in contact with the care homes can also be encouraged to get jabs if wherever possible. And also it's important to record the number of staff who've got direct resident contacts and receiving the flu vaccine so that uptake can be measured. And I think, as we said in the previous page, is we've provided you with a toolkit which will enable care homes to have resources such as posters, leaflets, digital tools to support in this winter preparedness. Next slide, please. As I said earlier, this year, all care home staff and residents can get a free flu vaccine under the National Vaccination Scheme. And the plan is to ensure that everyone is vaccinated by the end of November. And either staff can be vaccinated via their GP or in a community pharmacy in London. And of course, through the support of the nominated staff, then we'll ensure that the staff can get their jabs. and also the residents are getting their jabs. It's a good idea to have both done together wherever possible. And what has happened before is people have had pop-up clinics by community pharmacists and having all their staff and residents vaccinated on site. And also PCN arrangements for staff and residents have also happened. Just to highlight that each STP might have a slight variation to this plan. So it's just important to ensure you also check with the STP flu lead, because they will enable you to know the exact plans for your STP. And the website address you can see is for staff who might want to register with pharmacy to get their flu vaccine appointment. Next slide, please. Last webinar, we talked about having a tracker which supports recording the staff and the residents who are getting their jab, which is on the left. But we've got good news. This week, Capacity Tracker will have questions which are going to be added. And these questions include how many staff and residents are known to have a flu vaccination. And also it will allow care homes to be able to highlight where there may be issues in accessing flu vaccinations. And these questions will support, the daily tracking of what's going on. So hopefully from the 14th, if you have any other ways of collecting data, we will be encouraging everyone to start to use Capacity Tracker. Next slide, please. Like I said earlier at the beginning, we also had a workforce health and wellbeing risk assessments webinar that we ran. And on this slide, it would just help to get you access to that webinar, because we know that due to heightened concern over COVID-19, there were some groups that were affected much more than others. And this webinar and this resource was just to try and support care providers in ensuring that all staff are being looked after and that care homes are clear about the protective ways they can put in place to support staff. Next slide. You'll be pleased that it's probably my last slide of talking. So at this point, I'm gonna hand over to my colleagues who will introduce themselves as we go along. So I will hand over to, I think I'm handing over to Jane, Dan and Alice at this point.
Fantastic, thanks Ezra. We can go down to the next slide, please. So I'm Jane. I work in the out-of-hospital cell with Ezra, and I'm currently supporting some of the digital work with care homes and the out-of-hospital programmes of work. So what we've kind of looked at is just to bring you a real high-level flavour of some of the resources that can help care homes to prepare for winter. So covering briefly the DHSC policy papers, the COVID winter plan, the resource pack that we have worked on regionally, capacity tracker, continuing healthcare and some of the digital work. And as kind of people have been saying, please continue to ask questions as you go in. We will try and answer those either in the discussion or one of the team will come back to you. Next slide, please. So we've probably all read the winter plan, and I can imagine that there is not a lot that you were not already doing, but I suppose it just breaks it down into kind of an expectation as to how we will continue to work collectively, really focusing on the preventing and controlling that spread of infection in care home settings, which is especially important given the recent outbreaks in care homes and the the confirmation that a lot of these are not through admissions from hospital, but they're from community transmission. So really focusing on, as Ezra was saying, that preventing and controlling infection is going to be key over the next few months. Managing staff movement, so reducing that as much as we possibly can do. PPE, the COVID testing, and kind of like the seasonal flu vaccinations. I saw a really nice kind of like picture on Twitter that was describing all of these as kind of like Swiss cheese. So none of them work in isolation, but when you build them all up, they try and kind of like catch through those, kind of like reduce those holes and work together on it, which is I suppose what we're all trying to do. Really about that kind of continued collaboration, you know, continuing to look at discharges, which I know a lot of you are doing, that kind of like enhanced health and care homes framework. So not just the primary care DES elements, but also kind of like the community services, and really how we kind of like look at digital and technology support to kind of like to enable the care models that are kind of like being brought into those. The other kind of like bits you can kind of like read those through, but yeah, if you haven't read that already, it is worth kind of like having a look and reading through that one. Next slide, please. But what is the ask for providers? So what we kind of thought is sometimes at the moment there is a lot of asks on care providers. So we've just basically brought out what their summary of their actions needed to kind of like to be. And as you can kind of like see, there is nothing that would be surprising to kind of like to any of us. But it's good for us to be able to reinforce those clearly to our care home teams. Next slide. The care home resource pack. So we already know, hopefully, that the care home resource pack exists. This is a kind of like a pack that's been developed by a really great kind of like group of people across health and care to really enable some of the kind of like the guidance and the policies to be brought to life and be made to be sort of just really easy to use, right signposting, simple kind of like what they can do right now and where they can get further support if needed. And that covers a various kind of topics: testing, recognising signs of deterioration, MDT working, all sorts of different bits and pieces. We've had some really great feedback, but we are consistently kind of like looking for feedback. So if you do read it and you think actually we're missing something or that something's slightly changed, please let us know and we can kind of like make those amendments to keep that real and appropriate to our care homes. Next slide. So the PPE, as kind of like Ezra was saying, is that kind of like realistically that is going to be something that we need to be really mindful of. So in some areas we're starting to see kind of like people maybe not kind of like focusing quite so much on their PPE and actually that causing kind of like huge issues in terms of staff outbreaks. Majority in the acute sector, but I think it's kind of like worth being mindful that we just need to really keep this as our real key priority. So care homes can access a amount of PPE via the portal, but they are still needing to order their usual stocks as they would do, coming to their local authorities for support if they need it. That kind of they need to register on that, and they get a unique identifier that enables that one. And I suppose consistently reminding that the hand hygiene is so important to kind of like to everything, and the staff feeling confident that they know where and when they should be using it. And there's some great examples being shared about kind of like posters and things. So we'll try and kind of like bring those through that are being shared by care homes across the country. Next slide, please. So we've got, I'm sorry, I'm just kind of like raced through this and I've kind of like totally forgotten about which ones Dan's doing and which ones kind of like I'm doing. Dan, do you want to take over? Sorry.
Yeah, I'm happy to. I think I'm on from next, but I can do this one if you like. Hi everyone. Sorry, I've been pinging replies into the chat box as well. And thank you for all your questions, everyone. So this slide is just about information that you should be working with your care homes with, and they should be approaching you about as well, to make sure that they've got all the locally relevant information about clinical and other support. So just clicking on the poster and there's a link to the poster down at the bottom here, where you'll be able to put, you know, who is the local prevention of admission team or rapid response, for example, what's the most relevant primary care practice, who are the best contacts for the care home to have there, community nursing, etc. as you go along the slide. Yeah, and it's really just about making sure that the care home knows across the system who they need to contact and where they're most likely to get the most relevant local support. So I think let's go to the next slide. Cool, capacity tracker, which has come up in the questions in the chat. So capacity tracker, as hopefully we all know, started off as literally just that, tracking the capacity in care homes, and at the beginning of the first lockdown back in March, we were all requested to make sure that all the care homes, hospices, community beds, and I've probably missed some, substance misuse now has come on, are filling in their capacity on a daily basis. It's been mentioned already that London's now got phenomenal rates of response within that, and that's really thanks to everyone's hard work on this call and beyond. So that needs acknowledging as well. And as time's gone on, it's kind of grown. So it's not just putting in the capacity and the beds. It's also about filling in business continuity information, information relating to COVID, PPE, for example. You know, what are your stocks and levels of PPE? And as of I think it was a bit later this week, there's going to be some questions going on about flu vaccination as well. So just to keep a record of how we're doing and making sure that the staff are getting their vaccinations. And what you can see on this slide is just some really key contacts. So in terms of being able to get access or register, I think there was a question in the chat about being able to register to get hold of the information. It's worth also trying to speak to your local leads to see if they're compiling that information in the form of reports, so that it's kind of shareable across patches. And then down at the bottom, you can just see some user guides and recordings to webinars that our team and the capacity tracker team have put together and have generally been really well received and very helpful. Next slide. So this is just, I'm not going to go into depth about this one, but this is just kind of the governance of the capacity tracker program within London and how it fits in with the national and where everyone fits in terms of governance and reporting. But also I think the local contacts on the previous slide hopefully explain who you need to go to and who your first ports of contact should be. So we'll leave that one more for reading when we send out the slides. So next slide. Next one. Oh, there's a bit of a lag. There we go. So this one's just about the CHC deferred assessments. So at the beginning of COVID-19, the continuing healthcare was kind of put on pause, and it wasn't needed as part of the discharge process. So when patients were being discharged from hospital and potentially going on to their next phase of care, this was not needed. It's been reinstated, and there's quite a lot of detail. Again, because of time, I'm not going to go into the depth of what that's about, but hopefully it's all in there, and there are a couple of links to point you in the right direction for more information. but it is back and live, so it is now something that's expected as part of the discharge process if someone requires continuing healthcare. So next slide. All right, and I think it's Alice taking us from here.
Thanks. Hi everyone. So I'm Alice. I'm part of the out of hospital team as well, specifically around the rollout of NHS Mail. So this is just a quick reminder around all care providers across London who've got access to NHS Mail now. So we're just over 80% of care homes have access to NHS Mail, and just over 40% of home care as well. So each care home is set up. Each care provider is set up with a shared mailbox, and then individual accounts linked to that as well. We've got really high rollout of it across London, but the focus now really is on increasing activity. So of those 80%, just about close to 60% are actively using it. So this slide just starts to show you the ways that care providers can start to use it. So with pharmacists around prescriptions, GPs is a really key one of how care at the moment are keeping in contact with their GPs and securely transferring information about their residents. Allied health professionals, families, CCGs and local authorities, and hospitals as well. Next slide, please. So care providers are being really proactive around how they're using NHS Mail, and we've got a few examples here. What's really helping is the local authority or CCGs are helping to link them in with the wider healthcare system. So in Enfield, pharmacists are using NHS Mail to securely send prescriptions. So that's really helping. Hillingdon CCG, the medicines management team, are helping care homes start to use their email addresses by using it for medicines management, and Tower Hamlets are helping care homes use NHS Mail to use Microsoft Teams. So this is really helping kind of increase the engagement across their area. And just a case study that we have from a care home in Hillingdon around using, particularly during COVID, using NHS Mail to communicate with the GPs and sending photos to reduce that contact. And next slide, please. So this is just to say that the fast track to get access to NHS Mail is still happening. So if you do have care providers in your area who still haven't signed up to NHS Mail, the simple route is still available. So I've just highlighted it here. So you just have to complete a really simple form with their details, submit the form to our email address, which is just there. So London Care Homes NHS Mail requests, and then they will be given their credentials and they can activate their NHS Mail account. And just a few pointers: if you've got care providers who aren't sure where to start, emailing your GP is a really good place to start, your local authority and your community teams. It's really important to also make sure that traffic is going through their NHS Mail accounts so that they are reminded to regularly check it. And using teams such as the local authority teams and the GPs is a really good way to get that started. It's also going to help care providers get access to and involvement in additional digital initiatives, so proxy access, virtual assessments and remote monitoring. Next slide, please. Great, I'll pass back to Jane.
Fantastic, thank you. So as kind of like Alice was sort of saying, this is only the first step in terms of what care homes will be able to access over the next kind of like couple of years. But one of the most important things that they need to do right now is register for the Data Security and Protection Toolkit. So there's been a lot of work that has been done over the COVID period, and they're not going to lose anything that they've already got, but they do need to register to show that they are committed to completing the Data Security and Protection Toolkit, which doesn't need to be done now. So simply all they need to do right now is to click on the link answer those questions and just register. That'll mean that we know exactly which care homes will need support when the national support offer comes out, which we are expecting kind of like over the next month or so, that they would be able to announce what that will be, and those support should start in January of next year. If you have got kind of like any questions around the data security and protection toolkit, then do drop us an email. I'm just about to kind of like pop a message into the chat as to how you can get in touch with us around NHS Mail, DSPT, but also the support that is available via the digital social care kind of like page. Next page. And that's it from me, and I'm handing back to Ezra, I think.
Thank you, Jane, Dan, and Alice. For the next section, you're going to hear from Dan again and David. Thank you.
Okay, so next slide. And I'm going to go very quickly through this slide because of time. So really what this slide is about is just what to expect in terms of clinical support from other services. We've said community services, but by that we're talking about primary care, community and pharmacy. And there are links, as well as the information on the slide, there are links, 3 links towards the bottom, and they will really tell you a bit more about what to expect. And I'm going to actually hand over to David to go a bit more into detail about the primary care support in particular. So next slide.
Thanks, Dan. Dave McKinley here. I am a programme manager supporting the establishment and the development of primary care networks. In the interest of time, I'll be quick as well, but I'm just going to give a very brief summary of some of the requirements for primary care networks. I'm having a bit of trouble with my Wi-Fi, so I will turn my screen off just in case I fall out. But you'll probably be aware of most of this, to be honest with you, but just a very quick recap. Obviously, primary care networks are now required to deliver the Enhanced Health and Care Framework specification in line with the network contract DES. Some of you may be aware that that DES was updated a couple of weeks ago on the 17th of September, and there's only a couple of minor changes in relation to care homes, which I'll come to in a second. Probably the most important thing to know is that obviously that the requirements relate to all CQC registered care homes, nursing and residential, and that accounts for 1,329 care homes across London and 198 PCNs. Next slide, please. So this is just a summary of the key primary care network requirements in what they're supposed to do to support care homes. So you'll see that during spring and the early summer period, the focus was on alignment of care homes to PCNs and the appointment of lead clinicians for each of those care homes. From the 1st of October, the main elements of the service specification came into operation, and those were to coordinate or to arrange the coordination of multidisciplinary team meetings, to deliver weekly home, or to arrange the delivery of weekly care home rounds, ensure that each resident has a personalised care plan in place, and that new residents have a personalised care plan developed within 7 days of joining. And then finally, I suppose that by the end of March, the plan is that PCN government arrangements need to cover all care homes, and they should be finalised, including things like sharing care planning, information sharing and the like. But there are a number of other requirements as well, including fostering relationships, building good communication links and the like. Next slide, please. Just very quickly here, the main point here is that commissioners have overall responsibility for aligning each care home to single PCN. And as of the last couple of weeks, we understand that there is now 100% of care homes have been allocated, so that this has now been completed, despite a few local challenges. I'll move on to the next slide. Okay, so I mentioned that the network DES had been updated. The main change was regarding the clinical lead. There was now some flexibility around who that can be. Originally, it was supposed to be a GP or a group of GPs, but this has now been relaxed, and a non-GP clinician with experience of working with care homes can now be the clinical lead. And their responsibility really is around the provision of oversight and coordination of the Enhanced Health and Care and Homes service. They're not accountable for the care of individual residents, and that is still the responsibility of the PCNs. Next slide, please. the lead GP practice is to support the activities of the clinical lead, and the things like the MDT, the weekly home round, the personal care plans, and then the sort of annual structured medication reviews. There is quite a lot of local variation in how they are and how the local lead practices are working, functioning. But it's worth noting that the residence GP is still the responsible officer for delivering the care for individual residents. I think that's it for me.
Thank you, Dan and David. I will hand over back to Nina.
Great, thank you very much, everybody. So we've had some great questions in the chat, but I am also aware that we are running out of time with it now being 10 to 3. So what I would suggest, and I think the team would agree, is that we will take the questions, which are all amazing, really good questions, and thank you, Dan and Jane, because I know that you answered quite a few of these in the chat already. If we run through the questions and then we send them out as a document, as a Q&A document with the slides and the recording tomorrow, Ezra, would that be okay? You're on mute, Ezra.
Sorry, I'm chattering away and forget to take myself off mute. We've probably covered most of the questions through our Q&A, which we'll send out tomorrow, but maybe we can answer one or a couple of questions that people have raised in the chat box.
Okay, so if we go through to the first question then, which was from Sundaraj Sujesh, what is the criteria to class an outbreak? For example, the number of cases. Is there anybody that can answer that?
I don't know if Catherine is still on call, but as far as I'm aware, normally it's 2 or more cases. However, our public health protection teams always encourage that when you have 1 or more suspected cases, you need to talk to them. So the definition still remains 2 or more, but in terms of reporting, we would encourage that if you have at least 1 suspected case, you still have a conversation with LCRC.
Okay, thank you. And I can see Jane's got her hand up.
So it's not about anything related to that one, but I did forget to say we will also send around the information around the NHSX iPad offer. So that is open now for care homes to apply for an iPad if they haven't got one. So we'll send around that information following the session, but hopefully most of you will have already received that.
Thank you, Jane. And the second question was from Mira, asking, have community pharmacists received stock for vaccinating the population cohorts that do not qualify under the NHS?
That's a very good question. It's the one that we probably can't answer on here, but London does have a flu delivery group, which looks into all of those things. So if Mira can email us, I think we provided our email. We will then get back to her on that after we've checked with the flu delivery group.
Okay. Thank you, Ezra. And there are a couple of questions that came in based around NHS Mail. One was, is there a helpline for care homes if they have any issues with NHS Mail? Alice, can I ask you to answer that one, please?
Yeah, there is. So there's an email, so careadmin@nhs.net, and there's a number. I'll put both in the message, and we can also include that in the questions when they go round. But yeah, there is contact details.
Brilliant, thank you. And also with regards to NHS Mail, how many staff can be granted access to a generic NHS Mail email address?
So it's up to 10 individual accounts for each care home. We can increase that, but it really depends on how high the usage is in the home and what the needs are. But for most care providers, we can have up to 10.
Okay, brilliant. Thank you, Alice. And I know that Nicholas Ince had a question, and Dan, I'm not sure if you fully responded to all of it. I know that you answered quite a lot of it, but he was asking, can commissioners have non-PID access to the capacity tracker?
So part of that was definitely answered because none of the information is patient identifiable information, and so I guess part of the answer is you don't need that kind of access because all access is like that. In terms of getting access, people within your STP should already have access. So every borough should have system champions. That I didn't mention that in the text, but every borough should have system champions, and there should be a good mix of CCG and local authority representation within that. And every area has a local champion as well, or local leads as well, and they're in the slides. Lucy's just commented the help desk contact details need to be added to the resource pack. I think the email address and the phone number are within these slides. But yeah, good point. We can flag that as well.
Okay, brilliant. And I think the rest of the questions were actually answered in the chat by yourself, Dan and Jane. So I don't think there were any more unless I've missed any, but I don't think I have. I've gone through them all. So Ezra, I will pass back over to you. Sorry, Lucy, you've got your hand up.
Yeah, hi. It's just to say with a capacity tracker, if people, the first step is for people to register on the capacity tracker for, CCG staff or local authority staff, as they register, and then they need to let someone know that they've registered, normally someone like me, that Lucy McCulloch, who's the lead, and then say what kind of level of access they want to the capacity tracker and why. It's really important people are clear about why they want more detail than is available to them as a normal user. Does that make sense?
Yeah, that's really helpful. Thank you, Lucy.
Okay, thank you. Ezra, if I can pass back over to you for closing remarks, please.
Thank you, Nina. I just wanted to say thank you to everyone for joining us today. And I think, as we said, this webinar is being recorded and the slides should be shared hopefully tomorrow. So our communication team, they will ensure that if you're registered if you have your details and you register through Eventbrite, then they will email you. If you haven't come through Eventbrite, can you also add your details to the chat before you leave, please, so that we can add you to the list. Otherwise, thank you to our speakers. Thank you to everyone. And if there's anything that we've missed or want to ask us, please do contact us on the email, which will be on the slides. Otherwise, have a great afternoon. Take care, everyone. Bye.